Hi, this is Kim, and my signature assignment, I decided to do an acupuncture. Acupuncture is a form of traditional Chinese medicine. It uses the technique of inserting very, very thin needles into the skin at different parts of the body. It's thought that the stimulation of these specific points helps with illness and addiction, helps to relieve pain and reduce headaches, and also deals with mental illness and stress and anxiety. For my purposes, I'm going to focus on it as an alternative or complementary treatment to pain management. Studies do suggest that acupuncture can be very effective in helping to ease chronic pains such as back pain, neck pain, arthritis pain. They also suggest that acupuncture can help with tension headaches and prevention of migraine headaches. And again, it can also help with some mental illness and anxiety and stress. The understanding of acupuncture and how it affects the brain and body, they're not fully understood, but it is thought and believed that expectation and just the belief in the treatment can play important roles in the effectiveness of the acupuncture and pain, kind of like mind over matter. There are few complications generally reported using acupuncture. However, they can arise from bad practice, such as not using sterile needles, not placing the needles properly, and if you're not delivering the treatment properly, so not handling them properly, side effects can occur, such as infection, organ damage, and even CNS injury. Acupuncture should never be used in lieu of seeking professional medical help. It's important to also check the credentials of the practitioner before receiving acupuncture care. True acupuncturists receive education generally at the master's level in acupuncture or in oriental medicine. It's important also that if you're going to receive this treatment, that you do share that with your healthcare providers. Just as a side note, the National Center for Complementary and Integrative Health actually does have funding for research to help determine the effectiveness of acupuncture for pain management and other conditions. Also research to help understand how the body responds to acupuncture and how it might work. Just a little bit of background and history. Acupuncture has been around for many thousands of years, over 2,000, and I actually read even over 5,000 years. Kind of uses the theory of yin and yang and the need for balance between the two, and that's kind of the central concept of Chinese medicine. With acupuncture, it's thought that there are 12 main meridians. Each is either yin or yang, and each corresponds to one of the internal organs, which has its own 2 points of yin and yang. The main meridians form a circuit, and that connects with their associated organs and associated tissues. And acupuncture is thought to influence the circulation between the meridians to help balance the yin and the yang. So for pain and how they suspect treatment, acupuncture's good treatment is that pain is seen as a blockage in the meridians. Once the location's been determined, the acupuncture needles tap through the dermal layers, guided to a specific point, several needles generally. And it's thought that the stimulation caused by the needling provokes a response within the central nervous system, which helps with the pain. Acupuncture is thought to help reduce strain on muscle and fascia, regulate inflammation by affecting blood flow with vasoconstriction or vasodilation, and also desensitizing nervous system changes, which all can help with chronic pain. Also, studies do show that acupuncture is effective in treating chronic low back pain as compared to no treatment, and also as adjunctive therapy. The Joint Commission has actually recommended acupuncture as a treatment option for pain management, and although it's not usually covered by insurance, it can be provided in community or group environments, and that can help reduce costs. It doesn't always have to be a one-on-one treatment with the acupuncturist. Evidence supports safety and effectiveness of acupuncture as a single therapy for chronic pain treatment, but it's definitely found to play an important role in conjunction with other treatments, which helps really to decrease the use of the opioids, which can minimize the related side effects of opioid use and the dependency that is seen so widespread across our country right now. So my experience involves seeking treatment for some chronic shoulder pain I have due to a car accident. I generally get cortisone injections probably every 4 or 5 months. I have a tendency to wait until it's pretty out of control before I seek help. And I decided to see if maybe an acupuncturist, in lieu of getting the typical cortisone shot, would be an option that provided pain relief without the side effects I tend to experience after cortisone injections. They do make me very edgy and nervous and flush, and for a couple of days I just kind of feel like I have a fever and a little out of control, and I don't really care for it, but in the long run it's a good treatment for me for this pain. I don't want to take any kind of daily medications, and I definitely don't want to, any type of narcotic pain medicine. So that's been my course of treatment since the accident. The practitioner that I saw, she's been a trained acupuncturist for over 13 years. She got her education in California, but did her internship in Beijing, China. She does have a medical background. I believe she was a surgical technician prior to becoming an acupuncturist. She apparently experienced a dirty needle stick during her previous career. She contracted Hep C as a result and refused treatment with antivirals and decided to seek out some alternative therapy. So she found an acupuncturist and had really great results, and working with her doctor, they were actually quite pleased with her results as well, and told her to continue. So she did, and this actually led to her decision to learn acupuncture. I couldn't really sit down and do a whole lot of one-on-one with her, unfortunately, but I did kind of look her up on the internet just to get her background, and I did decide to receive treatment at her practice. I have a fear of needles, so that was a little hard for me to do, but believe it or not, the needles didn't really hurt. I mean, there was a slight discomfort, but it was minimal, nothing like a shot or a blood draw or anything like that. And then there was a sense of warmth that kind of spread over the area, and kind of a strange sense of relaxation, which could have been from the acupuncture or just, I don't know, they kind of say that your belief in the treatment can help, and I kind of went into that with a belief in the treatment. The pain did not go away with the first treatment, but it did subside, so I'm planning to receive some more treatments to see if I can get more relief before I go for the traditional medicine. So for me in practice, and I'll have a better sense of this after I have more treatments, but I would definitely recommend this as an alternative or adjunctive therapy for pain management. I believe we rely on anti-inflammatories and opioid medications much too much, and we should always be seeking alternative therapies for pain control. So I don't know that I would go into any education myself, but I definitely believe that, this could be a recommendation for patients that are looking for something a little more, or even ones that aren't. It could definitely maybe something they hadn't even thought about. All right, so that concludes my presentation. If you have any questions, please let me know. Thank you.